Right. Welcome, everybody. Thanks very much for coming along and braving the early morning. My name's Chris Steeples. I'm the Joint Managing Director of Aspire Healthcare, and we've got a rather interesting product idea here for you. It's something that's been going along for some time. It's going to be very, very difficult to actually get the whole lot done in 15 minutes, but hopefully this will give you a taster and a chance then to go and explore it a little bit more. Okay. What we're going to do is just give you a brief history of therapeutic clothing, talk about the functionality of this particular product, Dermasilk. As somebody said on the TV, this is the science bit. Then give you some idea of the evidence. We're all evidence-driven these days, and there's quite a bit of evidence for this, bearing in mind the type of product that we're talking about. Look at the costs. Everybody's interested in, can this save money? Is it going to cost money? How much is it going to cost? And then finally, and probably the most important thing, is what it means for the families who have children with eczema. How many people deal with patients with eczema at the moment? Quite a few. So you know the fun and games that goes on in a family trying to manage a moderate to severe eczema patient. This is a brief history. Dermasilk clothing first appeared in Italy. It's been invented by a lovely guy called Dino Montagnier, who is a silk expert. He knows more about this fabric than anybody else. And he has developed a wellness product which started life in Italy in 2002. We brought it into the UK in 2007, and within 5 months of launching it on the internet, managed to achieve drug tariff positioning, which was quite a shock, because for two guys working out of two bedrooms with a mobile phone each and a computer and a car, it suddenly had to grow up and become a proper company. We now have 8 published clinical trials on the use of Dermasilk from the British Journal of Dermatology, Pediatric Allergy and Immunology, Dermatology journals, all peer-reviewed, all sitting there available for people to see. 3 of them are CTs. Now, it's very difficult to do a randomized controlled trial with this product because it looks so different to anything else. But we've managed it in a couple of occasions, and we cover a wide range of disease areas now. It's found its niche at the moment in secondary care. Those of you who come across it will probably see it as a result of a dermatology referral. However, there's some suggestions now that maybe the primary care commissioning groups, etc., should be looking at this product as a way of saving money and improving the resource usage within the NHS. From a recommendation point of view, NICE guidelines still aren't up to date, but the EADV guidelines, which is the European Academy of Dermatology and Venereology, have actually been updated twice since this product was introduced, and on both occasions they recommend its use for patients with a SCORAD of 15 or above. Now, for those of you who are sitting there saying, what the heck's SCORAD? It's an eczema score used in clinical trial measurement, and it basically they're talking about moderate eczema upwards. So it's quite widely recommended from there. And why is it used? Because it stops itch and reduces flares. The two banes of our life when we're dealing with eczema on a daily basis. And this product's intended as a long-term prophylactic use. It's not like a wrapping garment where you would put it on to manage a flare for 10-15 days. This is long-term, and the product is designed to last for that particular period. So bear that in mind as we go through the rest. The science bit. Okay, fibre in silk. This is the standard silk that comes out of the silkworm, stripped of its outer sericin coat. Now, the sericin is the part of the silk that can actually generate allergic reactions. And if you look through the literature, you'll see lots of instances of contact dermatitis amongst patients, amongst people who are working within the silk industry. We take that away, so you end up with a silk that is exactly the same as you would use in sutures. So, hypoallergenic. I think there's been one instance in the literature of a patient who has an allergy to sericin-free silk, and he's in Japan. So hopefully we won't see too many here. Silk is made up of amino acids. It's a protein product. It's very similar to human hair and very similar to the skin. The two I've just highlighted on there, the glycine is an important protein in collagen repair, so it helps in skin restoration. And the serine is part of the natural moisturizing factor process that involves in emollient use and in development of the skin. Both of these are available in high concentrations within the silk, and it's one of the reasons why the silk is actually helping to minimize that irritation. Basically, we're acting like a second skin. So what happens is that you get an equilibrium between the silk and the environment rather than the skin and the environment. So you're acting like a second moisturizer layer on top. But silk needs protection. If you feed silk bacteria, they grow because it feeds on the protein. So what you have to do is put onto the silk an antimicrobial. It's one of the reasons why we don't recommend the use of standard silk from Marks and Spencer's or Victoria's Secrets or wherever for treating eczema. Okay? You need to cover it with an antimicrobial, because if you don't, you actually grow bacteria and fungi. And we all know larger levels of Staph aureus on skin with children with eczema. So if you put something on that isn't adequately protected, you will just help to grow the bacteria. And we've used a specialist antimicrobial called AM 5772/5. Slips off the tongue so easily you can remember it daily. But basically, this is non-migrating. Oh, we've got escape. Yeah. Have I said something? Never mind. But basically what this is doing is it's a non-migrating antimicrobial. It stays on the silk and it doesn't migrate onto the skin, so it's not going to irritate the children. It's not going to get caught in their blood supply if they absorb it systemically. It is permanently bonded. You can't wash it off. You can't wear it off. And that's important, because if you're using things like silver and other agents which are migrating, you can build up levels over continuous use on the skin and potentially into the systemic circulation. This doesn't do that. So, why here? One is 100% sericin-free fibre in silk, antimicrobially protected, and more importantly than anything, it's smooth. Children like wearing this product. You will not have a fight getting this onto a child. Where's the evidence? Sitting there. For a start, it's a Class 1 medical device. Therefore, it's gone through a regulatory process as such. 8 published clinical trials. Anybody who wants to see them, they're available on the website. You can look at them, you can read them. They're all sitting there. EADV recommendation, as we mentioned. And something called POEM score. Anybody come across POEM? Patient-orientated eczema measure. It's a recognised way for allowing patients to actually measure their own eczema severity. And it's been listed on NICE, approved and regulated against things like the SCORAD system. So people know it works. We'll come back to that very shortly. As I say, it's been used in hospitals now for over 5 years with tremendous success. And really it speaks for itself. With a small company like mine, we can't spend large amounts of money on marketing. Therefore, the product has to speak for itself, and it does. Have you come across any other medical device product with such a large amount of data? Also, those 300 patients include children and adults. Don't forget the adults. 2% of the adult population have some form of dermatitis. And many of them, it's a long-winded thing that they've had for years. They're not going to clear it up, so they need to look for other alternatives. Studies long-term, three months currently. We do have a 12-month study going on at the moment, and there is a large study about to start in based in Nottingham, which will look at a cohort of over 300 patients. So it is well researched. And that's an interesting one, as good as mometasone. People have actually tried this, putting Dermasilk on one arm and on the other arm 7 days of a topical steroid. And at the end of 7 days, no difference between the two arms. But the clinical study of one is the one that drives everybody. If you've got experience in how the product's used, you'll keep using it. And this is a young lady who, 9 months old, appeared on our radar, I suppose, about April last year. Florence, at the time, 9 months old. Her eczema was so bad, she was losing weight. She was listless, she wouldn't concentrate, she had no interaction with parents. She was like a rag doll. In desperation, they'd gone through the hospital, they'd gone through the nutritional side of the hospital as well as the dermatology. And in desperation, they bought some Dermasilk from us from our website. 5 days later. We like these sort of things. Mum's comment on her email was, "I have a new child. She's full of beans, not only because she's lively, but also she was raiding the beans off their plate as much as raiding everything off her own food. Showing a great interest in food, both hers and theirs. Started putting on weight, and we had a health visitor in tears." And I think that's the sort of transformation. And just to give you an idea, that's 5 days later. Her pictures, not ours. Because I actually said to her, can we use the pictures, because we'd like to put them on a piece of literature, but we'll blank off the face, as everybody does in clinics. And they said, no, don't blank her face, we want everybody to see her. So there she is, there's Florence. Poem scores, this is what I was talking about, the eczema measures. This allows patients to measure their own eczema improvement. So what we did was we got 50 patients. When they started on Dermasilk, we asked them to complete a poem score, and then 4 weeks later asked them to complete again. That's the result we had. Maximum score of 28. We were up at around about 17, down to 3. That's quite a significant reduction in patient-orientated severity. So that's how the patients and the parents perceive the effectiveness of the product. 79% overall reduction, but most importantly on there is over 2/3 showed a complete absence of sleep disturbance. Now, anybody who's dealt with eczema knows they sleep badly. And if the child sleeps badly, mum sleeps badly, and if mum sleeps badly, all hell breaks loose in the family. So this is where we score heavily on the brownie points. However, the elephant in the corner, and you've also been sitting there saying, what's the cost? Okay? What I would ask you to think about is, what's the value? Because this product has a cost. A vest like that, like this one. Okay, and you pass that around and have a feel. Around about £39. However, this is designed to last like normal clothing. This is not a wrapping garment that has a 20-wash lifespan. And we find that children will actually outgrow Dermasilk. So much so that in some hospitals where they have eczema running in siblings, they pass these garments down through the siblings because they last that long. We recommend that no more than 2 garments are prescribed at any one time, and they don't go on repeat prescription because these will last 12, sometimes 12 months, sometimes a little less. So from a cost-effectiveness point of view, 2 pairs of pyjamas over a 9-month time span will cost about 50 odd pence a day, which is less than you should be spending on your emollients. By comparison, if you were to wrap a child, you're looking at around about £8.50 a day. The additional benefits, though, are similar. Fewer flares mean less prescribing of emergency products. Fewer visits to clinic and surgery. All has a cost. You might be fixed in one point, but if you're not seeing somebody with eczema, you could be seeing somebody else. Fewer visits to clinic. The average dermatology consultation now is upwards of £200. So this is half the price of a dermatology consultation. Better sleep for the family. What does that cost the economy? We don't know. But more importantly, it's more Florences. So, who should use it? Well, NICE estimate that there's 250,000 patients out there with moderate to severe eczema. Now, if I advocated every single one of those, we'd bankrupt the NHS rather quickly. So be selective. Patients with 6 or more flares a year, where it's causing a significant problem to their family life. Patients who are prone to infection, this product can be used in the presence of infection because it's not occlusive. So it will help all the way through, even if an eczema becomes infected. Those people who you're planning to wrap, quite often the hospitals these days will wrap somebody for a week and will then pass them on to Dermasilk to control the eczema flares. And if you can reduce the flares from 9 down to 3 or 4 a year, then you're saving an awful lot of time, effort and money. And those that are being considered for hospital referral. As I say, half the price of a hospital referral. Quite often it's worth having a go at this, because that's what a lot of the hospitals are doing anyhow these days. But don't forget the adults. We concentrate on the children, but I get lots of letters from adults saying, yet again you've ignored us, we're the children of last time, we're the ones that are lumbered with eczema all the time. Adults don't grow out of eczema in the main. Once you've got it beyond 12, 14, you're stuck with it. So this can actually help them, because they've tried everything, been everywhere, done everything. And we find a lot of adult patients actually benefit quite significantly from this product. In addition to that, if it lasts 5 or 6 years, which it can do, then it's extremely good value for money for the adults. So, brief resume. Everybody's got 15 minutes to think about it. What I would ask you to do now is, if you want more information, please go on our website. There's lots of information on there. Go on the Journal of Family Healthcare website. NHS TV has a video, which I've been showing prior to this, which is explaining how the product's used in clinical usage within a specific hospital. Or you can come and ask us any questions. And then finally, just a little surprise. We also do some bedding called dermatherapy. If you come across anybody suffering from night terrors, just have a look at this and talk to Jo down on the stand, because she's had personal experience of dealing with night terrors with a 9-year-old, and this is quite unusual. There's no clinical data to support it, but it's there to be able to demonstrate personal effect. So as you see, Espere Health, leaders in biofunctional textiles, therapeutic clothing. Hopefully this has caused you to have a little bit of think about it and reevaluate just how it fits in with other common used medications. Thank you very much.